This is Dr. Armin Tehrany. I've discussed with my patient, Mr. Ilham. You agree that we can have this conversation so that we can educate the public about your situation today?
Of course.
Great. We are taking very carefully what types of patients are appropriate candidates to have arthroscopic shoulder or knee surgery. And this gentleman has a history of dislocating shoulders, and he had a recent dislocation, which is not the first time his shoulder's dislocated. It's getting worse, it feels unstable, it's affecting his ability to do his life, and he needs to travel back to the United Kingdom in the near future. And so, after examining him, discussing with him the risks and benefits, as well as the risk of coronavirus, we decided to proceed. We're being extra safe, as you can see. We're wearing masks, we're having gloves all the time. And this being an ambulatory surgery center, it's very different in terms of safety than a hospital. In a hospital, that's where coronavirus is being treated, so it's much riskier. But in an ambulatory surgery center where all of us are taking extra special precautions, I feel like the special one that we have, it's really clean and safe, like a supermarket would be when you go in and everyone's making sure that they're wearing gloves and being safe. So we feel confident to proceed. We're going to go ahead and reconstruct his tears from his unstable shoulder, which is painful, and things should go very well. Thank you very much. Hi, Dr. Tehrany. This is a patient we talked about with a shoulder instability, where the shoulder is unstable, and he was feeling worse and uncomfortable and needed to have something fixed. And so we look inside the joint, and we see this is the joint. The joint is the glenoid, which is the socket, and the ball, which is the humerus. He tore the labrum here. This is labrum. This is biceps, and that labrum is torn. And then when you look carefully here, this labrum is torn as well. And that's what we're going to repair today, to try to stabilize his shoulder to make him able to eventually have good normal function and no pain. Go ahead and shave. Great. Okay. He also may have a posterior labral tear as well, which we have to repair as well, so we'll look into that. At the beginning of taking care of the slap tear. This is a device that's metal that will connect to the special sterile tape that we'll add. Okay. So this is the tape right here. This tape goes through. Would you rethread this device, please? My assistant grabs that piece of tape. We need both limbs pulled up.
Joe, please.
This is a guide for us to create a hole in the socket so that we can bring that labrum down onto the side.
Good. Go back.
cut that excess tape, which the patient doesn't need. And now we've taken that labrum probe, please. I'll show you. We've taken the labrum, which is this part, which was unstable and detached from the socket, and using the anchor and this tape, we've repaired it. The biceps looks okay. You can stop. So this is looking at the same patient and seeing this tear of the shoulder looking from a different viewpoint. And you can see clear evidence of a tear of this labrum off of the glenoid here. This is unusual and this is abnormal. Unfortunately, he's also over time caught some fraying on the other side. And if we look with a probe, we can see that this is a small tear there. So I'm going to fix this, but also for not only treatment but for prevention, I'm going to put an additional anchor for this tear because this looks like it's going to get worse as time goes by. We can prevent that. I'm going to prepare this bed so that it's prepared for the anchors that we're going to be putting in. Okay, Nicholas, now. Make sure we get a nice thick bite. Okay, nice bumper here. Switching stick to the blue. Okay, we have a few cannula there. Another cannula. These are devices that we put inside the body that allow us to do our surgery and pass things along. We have a shaver first. Take care of that. Not unlike the way we did the slap repair, we passed this metal device through. And then I'm going to pass tape through it. Yeah. And we carefully pull the tape across through the labrum. Would you read that? Now we've got that labrum ready for fixation. Joe, please. So in that process, we pass the anchor into the bone, and it holds that labrum and capsule, as you can see, onto the socket where it belongs. And that's a nice bumper, which is what we want to see. So before, the part of the labrum that was torn is here, and this is the repaired part of the labrum. So this is repaired. Now we're going to go to the other side, and I'm going to move my camera so that I can see it better. And so that's from before the repair. And here we go ahead and take the area that I mentioned before that that I thought would be an issue and put an anchor there to protect it and prevent the problem. Okay, so this is the posterior label, this is the back. I'm going to pass the tape through here. And a similar manner to get answers to the option. And ability to grab that piece. Go ahead. Rethread that, please. It's a big guy, so it's a little bit difficult to be able to get to that tissue. Go ahead. Jeremy?
Yes.
Can you airplane the table safely towards me, please?
Yes, I can.
I'm just going to airplane the table so that I can have a better angle to ensure so. That's good, thank you.
Okay.
Ready? That's the black one.
Yeah.
Go back. Go back. We have that anchor down. You can see it. It's embedded under the bone, and it's brought the labor back where it belongs. Let's airplane the table back to neutral, please. Okay. Ankle sign. That's good. That good? Yeah, much better. Thank you. Let's proceed. Put another anchor. Read that one last time, please. Drill, please. Just drilling a hole to prepare the next anchor. Good. Go back. After we put this one in, I'm going to take another look and see whether or not we need to do a final anchor in the front. Might not need to. Good. Good. Bury that black line. That means that ankle will be down far enough and deep in the bone where it should be. Please. So this is the bumper that we want to see, where we get a nice cushion that protects the ball from coming out of the socket. This is kind of like a bumper that up on the socket. It's like a golf ball on a golf tee. We're trying to prevent this ball from coming out this way and going out that way. And you know what? I think we may. I'm not sure if we even need another one yet. Let's take a look here. But we right now have a total of 4 anchors in the body. Let's see if that's sufficient. So here's one up top. Here's 2. Here's the one in the back. Let's take a look at the probe. You know what? I think we're okay. I think that did the trick. Luckily for him. I'll take one last look. Probe. I think that's it. Feels solid. I think it feels really solid. So this is the completed repair. We're going to put him in a sling for protection for about 4 weeks and allow him to start range of motion with physical therapy somewhere we trust, where I've spoken to the CEOs of the PT firms, and they ensure that there's good social distancing so that he can go twice a week to get his therapy, and we'll be in touch with him via telemedicine, and we're expecting to have a good result. I just wanted to give a little follow-up on our patient who we did shoulder surgery on. Christian did real well. You know, his arm's a little bit numb because we do a nerve block in order for him to be numb, but that's better than having pain. He did well. The surgery went well. We had to put in 4 anchors in order to stabilize and reconstruct the shoulder. And so I'm real happy that it went so well, and he's feeling well. And I spoke to his fiance, who we're going to go out to say hello to and explain things. I have to keep them separated for now. I can't bring those patients into the family, that is. I can't bring them into the recovery room because we're having extra COVID precautions, but they understand, and things should go very well. Any final thoughts, Christian?
No, I appreciate it.
Okay, my pleasure. My pleasure. Okay.